Hi, I'm Susan Bornstein.
And I'm Jeff Sockham. We're here today with our second conversation about healthcare delivery system reform. Today, we're going to talk about social determinants of health.
Jeff, this is not something that I was taught about in medical school, and we will not talk about how long ago that was. But these factors have an enormous effect on patients' ability to access and pay for their health care as well as their actual health. Can you give us a little background on the subject?
Yeah, absolutely, Susan. And this is something that I'm really passionate about. The social determinants of health are the conditions in which we're born, grow, work, live, and age, and the wider set of forces and systems that impact our daily lives. For example, things like economic policies, social norms, and political systems. Social determinants of health affect a wide range of health risks and outcomes. And social determinants of health affect some populations or groups of people more adversely than others. Let's start with where we live. Do you live in a neighborhood where it's safe to go outside? Do you live near a park or in a neighborhood where it's easy to run, walk, or ride your bike? Do you live next to a factory where the air you breathe contains chemicals or smoke? Do you live in an old house or an apartment complex with lead paint on the walls or lead in the water pipes? Do you have a grocery store that's easy to reach, where there's access to affordable fruits and vegetables? These are all questions which providers don't typically ask their patients, but which will clearly impact the patient once they leave the clinic or the hospital. Healthy and unhealthy factors add up, with evidence suggesting that social determinants of health impact 80 to 90% of our health, with healthcare impacting the other 10 to 20%. For economically disadvantaged groups who have less control over where they work or live, the social determinants of health perpetuate a cycle of inequity: greater sickness, lower quality of life, and shorter life expectancy.
How we live affects the quality of our health, although some aspects are more obvious than others. Most of us know that smoking, drinking, and illicit drug use are deleterious to our health. Okay, a little red wine is okay, but more than 7 to 10 drinks per week for a woman, or more than 10 to 14 drinks per week for a man, are concerning for a possible diagnosis of alcohol abuse. Tobacco use, on the other hand, is never good for you. It's associated with a greater incidence of respiratory diseases such as emphysema and bronchitis, heart disease, multiple forms of cancer, including some that most of us know, such as lung cancer, and others that are less well known, such as bladder cancer, preterm delivery, SIDS, sudden infant death syndrome, and more. The dangers of methamphetamine use and opioid addiction are well accepted and are associated with increased risks of overdose and death. Another aspect of our lives involves our interpersonal relationships and our degree of social support, which have considerable effect both on our health and on the health care that we ultimately receive. Domestic violence is an example of an extremely dysfunctional interpersonal relationship and is associated with increased risk of harm, depression, and anxiety. Domestic violence also increases the likelihood that victims will refrain from presenting for medical care. They may be ashamed. Their abuser may restrict their ability to travel to appointments freely. The presence of abuse may also be associated with less compliance with medical recommendations. One example in the general category has stayed with me for decades. I had a patient who was depressed and who, after considerable cajoling, finally agreed to begin antidepressant therapy, although she remained unwilling to go for counseling. On follow-up, she was feeling significantly better. Much to my dismay, at the next visit, I noticed that she was depressed again. When I asked why, she replied that her husband was opposed to the use of antidepressant medication and he made it impossible for her to continue. His controlling behavior, which may or may not have risen to the technical level of abuse, was a social determinant of her health. Repercussions of social determinants of health have been highlighted by the COVID pandemic in many ways, from an epidemic of loneliness with many people, particularly the elderly living in congregate care facilities who have been cut off from family and friends, to the greater number of infections and higher mortality in the Black and Latinx communities. Jeff, speaking of racial disparities, how does race factor into social determinants of health?
Great question. You know, that's a huge topic and one that deserves its own program. As an overview, the data shows significant disparities between minority populations and whites, with minorities experiencing a greater burden of disease, shorter life expectancy, and increased maternal and child mortality, much of which can be associated with social determinants of health. These communities may also face explicit or implicit bias or discrimination on the part of their healthcare providers.
In the last few years, studies have shown that a substantial proportion of doctors thought that Blacks experienced less pain from surgery, et cetera, and therefore prescribed those patients less pain medication. Medical history has been rife with examples of mistreatment of or disregard for the dignity of patients of color. In the notorious Tuskegee study, for 40 years, from 1932 to 1972, Black men with syphilis were told that they were receiving free care from the federal government, but were actually intentionally left untreated so that researchers could assess their progression of disease. Another example is the harvesting of Henrietta Sacks cervical cancer cells, known as HeLa cells, for research without her consent or attribution. This history of which these are only two of the more well-known examples, has led to justified mistrust of the healthcare system by minority populations. So trust can be a huge issue affecting whether an individual will seek care and how they perceive the quality of care received. The degree of satisfaction with their care can then affect compliance, which can adversely affect their health, and it becomes a vicious cycle.
And another thing that we don't always think about, but which impacts whether or not we seek care, as well as our compliance with providers' recommendation, is our healthcare literacy. How do we perceive and act on the changes from our usual state of health? Do we ignore a chronic cough thinking it's just allergies? Or are we aware that it could be a sign of a much more serious condition, such as lung cancer? If we go to the doctor, do we understand what we're told? If not, do we have the courage to challenge the provider and ask for additional information? Do we understand the risks and benefits of the recommended treatment? If not, it's more likely that we'll fail to follow through on our part, which may worsen our outcome. And do we have a language barrier which prevents us from fully understanding our health situation in the first place?
From a comprehensive, holistic approach to patient care, there is no question that we should be addressing social determinants of health with our patients on a regular basis. However, there are considerable obstacles to integrating this into the patient's visit. Who will ask all of these detailed questions? How and where will they be recorded in the medical record? Who will act on the findings, and how will they locate the resources necessary? What will the follow-up be? At least one electronic medical record system has the capability of collecting this information, but there has been very slow implementation. A significant obstacle is that there is currently no reimbursement mechanism to affect the increased time and cost involved. This inattention to social determinants of health, both in time and energy, is far more common in the United States compared to other developed first world nations. The majority of the other high-income countries spend $1.70 in social services for every dollar spent on health services, whereas the United States only spends 56 cents for social services for every dollar spent on healthcare services. Yet, while they spend more on social services, these other countries not only have lower overall healthcare costs, they have better outcomes compared to the United States. Their investment in social services is a key driver of these outcomes. Unfortunately, discussions surrounding the provision of social services in the US have become very politicized. The truth is that attention to social determinants of health can improve health and drive down costs.
So Susan, what can we do to increase our focus on social determinants of health?
We can reach out to our local and national leaders to find out how we can improve the quality of life in our community. We can join or financially support groups which advocate for green spaces, safe drinking water, lead paint removal, the ability of all people to have access to healthy, affordable foods, and have universal access to health insurance. We can become aware of how racism impacts all of us and how we can adopt anti-racist behaviors and facilitate adoption of anti-racist policies. We need to know that domestic violence affects 1 in 3 women and 1 in 4 men, and where we can refer those we love for assistance.
We have an opportunity in our country to think differently about healthcare. Better health and lower costs are both possible. We can learn from other countries who are doing it differently, or from parts of our own country who are best in class. Join us again next time as we talk about how mental health impacts both our physical health and our well-being. Thank you. And thank you, Susan, for your time today. Always a pleasure to connect.
Jeff, it's been a joy talking to you, and I'll look forward to our next discussion. Bye-bye.
Bye. Take care.